Hello, my name is Brittany Malassaw, and today I'm going to be talking about the Nurse Practice Act. So you're probably wondering, what exactly is this? So the Nurse Practice Act is a law that has been put into place by each state to pretty much outline the responsibilities of each nurse, the scope of practice that they can practice under, and then the quality of care. And this also comes into safety. You want to make sure that everything you're doing as a nurse is safe and within the right measures of the hospital and each state that you work for. So there's four components of the Nurse Practice Act. First being education. This is getting your degree, making sure that you are knowledgeable and have what it takes to be a nurse. So this is your associate's degree, your bachelor's degree, etc. With following that, you have your credentialing process. This is taking your NCLEX and getting that license to be a nurse and to go on the floor and practice. Without this, you cannot be a nurse. Disciplinary action. If you're on the floor and you commit a harmful crime or you do anything harmful to your patient, whether that be negligence or malpractice, you will have a consequence for your actions. And the Board of Nursing is really important when it comes to that because they're the ones who pretty much states, okay, you did this thing, this is going to be your consequence. They also put out regulations for each state and what you can or cannot do as a nurse. And they also make sure that you have your license. And if you don't, you need to get it updated or make sure that you do the steps to get your license. My BSN Essential that I chose for my topic is quality and safety because the Nurse Practice Act, it's all about quality and safety. That's the reason why I was put into place. Because quality and safety is the core values of nursing. Without quality and safety, there'd be terrible nurses. It would be terrible on the floor, So this just ensures that, you have quality and patient-centered care and that safety is the utmost important thing. As a nurse, you are the forefront. You are the ones doing assessments, interventions, passing meds. So, you need to be safe. And again, you need to have patient-centered care. And like I said, the Nurse Practice Act just ensures that you are educated enough and you have that education and license to be able to perform the patient-centered care and have safe practices. The QC competency that I chose is safety. I've said it over and over again. Safety is the biggest thing when it comes to this act. It just makes sure that the risk of harming your patients is minimal to none and that you are having effective and safe care. As a nurse, the website goes into depth about, you should know all sorts of things as a nurse and when it comes to safety. You should know unsafe practices, not only what you should be doing, but if you don't do those things and you perform unsafe practices, you will have consequences for them. You also should know the benefit of technology because technology is so advanced and used in hospitals all over the world. So with technology, you will have safe practices. So med passes, you should be scanning wristbands to make sure that it matches the chart, it matches the meds, it matches the patient, And also pulling meds whenever you're getting them out the Pyxis or whatever system you have to pull medications. Whenever it lights up, that's the medication that you should be pulling. This ensures that you're giving the right dose, you're giving the right medication, and that you don't harm your patient. And the Nurse Practice Act just focuses on the responsibility. You are responsible as a nurse, and if you don't do the right and safe thing, you will be held accountable. So with all that being said, I have a reflection question for y'all, and this is just, with all the information given, what do you think would happen if this Nurse Practice Act was not put into place? Think of all the components, your education, your credentials, the Board of Nursing. If all of that wasn't a thing, what would happen? And these are just my references, and that is all. Thank y'all so much for listening.